world, we cannot allow health care to become wealth care. I thank you for yielding the time, and I gladly yield back to you.
Thank you, and thank you for making those points and for making them so passionately. And I know you said that we save $1 trillion over the next 20 years, but I am confident that the savings will be more than that when we look back on the good that this bill is going to be doing over those 20 years. I just want to say a few words about the bill. Some of it will be repetitive, but for the first time, the Patient Protection and Affordable Care Act is finally making a significant investment in prevention. We're finally beginning to turn what's supposed to be a health care system into a real health care system and not a sick care system. The old adage, an ounce of prevention is worth a pound of cure, is still true. And it's true, no more true than in health care. In my family practice, I would see patients who had difficulty getting their preventive care, getting their mammograms, their colonoscopy, and other preventive services. That will no longer be true. And so they would come in sicker. And some patients would come to me after being sick for a long, long time when they had far advanced disease. So I know that that is the same not only in my district and in my practice, but it's the same for many low and middle income people everywhere in this country, but especially for African Americans, other people of color, of course the poor, and people who live in rural America. But let's talk about African Americans and preventive care. 20% of African American women are not up to date on their pap smear. 32% of African American women are not up to date on their mammograms. And 45% of African Americans have never had a colon cancer screening. The Affordable Care Act, the Patient Protection and Affordable Care Act, takes important steps to reverse this trend and make sure that all Americans can afford the preventive care that they need. And this will reduce the premature deaths. It is said that in this country every year, about 88 or more thousand people die in excess numbers that should not have died if they had received the preventive care and the kind of health maintenance that we want them to have and that this legislation will allow them to finally have. Today, the life expectancy for African American men is 7 years shorter, and for women it's 5 years shorter than our white counterparts. There's an article, I was reading on Medline Plus. Overall, the national life expectancy was nearly 75 for men, 60 for white men, 68 for black men, 80 for white women, and 75 for black women. Washington, D.C., the nation's capital, has the largest life expectancy disparities between blacks and whites. 13.8 years disparity for men and 8.6 years for women. New Mexico had the smallest disparities. Let me just mention some of the states with the largest disparities. More than 8 years for men: New Jersey, Nebraska, Wisconsin, Michigan, Pennsylvania, and Illinois. And the ones with the largest disparities for women, more than 6 years: Illinois, Rhode Island, Kansas, Michigan, New Jersey, Wisconsin, Minnesota, Iowa, Florida, and Nebraska. Surely all Americans, but African Americans in particular, have a serious stake in the Patient Protection and Affordable Care Act. It's clear that our lives really depend on it, but not our lives alone. It will also, as has been said, reduce health care costs. The Joint Center for Political and Economic Studies reported about 2 years ago that the direct and indirect costs of health disparities in this country over just a 4-year period was $1.2 trillion. And we could save that money just by reducing health disparities in this country. Of course, now 26-year-olds can stay on their parents' health insurance for the very first time. I remember when my daughter turned 22 and I had to drop her from my insurance coverage. The insurance coverage I had right here in the House of Representatives. But now, 2.2 million young people, of which 400,000 are African Americans, are being covered on their parents' insurance. 17 million children can no longer be denied because they have a pre-existing disease, just because they're sick. Children with asthma, children with sickle cell disease, and the children who are increasingly having diabetes, they can no longer be denied health coverage. They have access to health care. In 2014, that will be extended to adults who also will not be able to be denied health insurance because of pre-existing diseases. And there are up to 129 million Americans under the age of 65 that have a health condition that could make it hard for them to find health insurance. Going back to African Americans again, who suffer disproportionately from multiple chronic diseases, we need this benefit. Deaths from cardiovascular disease were 30% higher in African Americans. The prevalence of diabetes is 70% higher. It's also very high in the American Indian population. African Americans represented about 55% of all adult AIDS cases and 65% of pediatric cases, and our infant mortality is more than 2.3 times higher than our white counterparts. And as you heard from Congressman Green, being a woman will no longer be a pre-existing disease. It's amazing. Being a woman is almost like having a pre-existing disease. They don't deny us the insurance, but they charge more. And there's another article from the New York Times written by Robert Peer, and I'm reading from it now. It says, for a popular plan in Chicago, a 30-year-old woman pays $375 a month, which is 31% more than what a man of the same age pays for the same coverage. In the states that have not banned gender rating, and I think there are about 28 or so that have, 26 or so that have, but in the states that have not banned gender rating, more than 90% of the best-selling health plans, 90% charge women more than men. So many testimonies of people that we heard from while we were having the hearings in preparation for developing this bill, of people who lost their coverage because they had a serious illness. I remember one lady with breast cancer. They dropped her coverage. I remember a young girl who had had a liver ailment in her infancy. She could not get coverage. Her parents almost had to sell their homes and become destitute to be able to provide coverage for her. But that would not happen now under this Patient Protection and Affordable Care Act. You can't have benefits cut because of lifetime limits anymore. Before the law, 105 million Americans had lifetime caps on their care, including 10.4 million African Americans. Who wants to go back to those days again? No one wants to go back to those days. We're not going back. There can be no scrimping on our care to give bonuses to the CEOs or for fancy ads. At least 80% of premiums must be used to provide health care services. Before the health care law, some insurance companies spent as much as 40% of premiums on administrative overhead like marketing and CEO bonuses. Now that cannot be any more than 20%. I have a pet peeve about Medicare because I keep hearing, especially my Republican colleagues, saying that Democrats have cut $500 billion out of Medicare. That's not exactly what happened, and I think the American people understand savings. We found savings, $500 billion worth of savings, and we use it to make, most of it to make Medicare stronger. I'll go to some of the facts here. It reduces the prescription drug costs for seniors. Health care law provided a 50% discount on brand-name drugs for seniors in the Medicare Part D donut hole. 3.6 million seniors have already received that discount, saving a total of $2.1 billion, each senior saving an average of $604. It provides free coverage for key preventive services, and 32.5 million seniors, 25.7 in traditional Medicare and 6.8 in Medicare Advantage. They've already received one or more free preventive service. It provides a free annual wellness visit. It strengthened Medicare. By providing those savings and putting them back into Medicare, we strengthened Medicare and extended its solvency by 8 years, from 2016 to 2024. We have more work to do, but we extended it by 8 years. And it helps seniors remain at home and stay out of nursing homes, and provides nursing home residents with more protections from abuse. The average premiums for Medicare Advantage enrollees are 7% lower in 2012 than they were last year. And since the health care law was enacted, those premiums have fallen by 16%. The Medicare Part D deductible has fallen by $22 in 2012, the first time in Medicare history the deductible has fallen. So we didn't hurt Medicare. We did not take money out of Medicare. We found savings in Medicare, mostly from fraud and abuse, and also from leveling the reimbursement to providers so that the Medicare Advantage did not have that much more reimbursement than other providers, and we made Medicare stronger. So today, 47 million Americans are benefiting from a stronger Medicare program. We put Medicare on a stronger, more secure course, and we're not going back, and we're not going to vouchers where the beneficiary will take on a lot more of the cost. We will not break our commitment to seniors and people with disabilities. Small businesses also. We've heard of that they've done well. 360,000 small businesses used tax credits and covered 2 million employees in 2011. And I know those 2 million employees and the people that employ them don't want to lose that coverage. We don't want to go back. We will oppose any attempt to take us back to the days when we could not provide help for our small businesses to provide insurance for their employees. As was said earlier, health care is a right, and President Obama led, and we work with him to ensure that that right is there for every American. We also worked very hard, the Tri-Caucus did, the Black, Hispanic, and Asian Pacific Caucus, American Caucus, to include health equity as a part of this important law. In it, discrimination is expressly prohibited. There are core objectives within it to reduce health disparities and to create health equity. There's data collection. You don't know what you don't know that you don't know. There are health professions provisions to increase not only the overall health care workforce, but to make sure that that workforce looks like America, that there's diversity in that workforce, and to support institutions that train underrepresented minorities. We created offices of minority health in some agencies of the Health and Human Services that did not have them, such as SAMHSA, the Substance Abuse and Mental Health Agency Administration. We know that mental health issues often go undiagnosed or underdiagnosed or misdiagnosed in people of color or people of different racial and ethnic backgrounds. We need an Office of Minority Health there. We needed one at FDA to make sure that when medicines are approved, that they have been tested in minorities and people with disabilities and other comorbidities. And I've had bad experiences with CMS asking about the impact of changes in medication and end-stage renal disease, where we know that African Americans and some other subpopulations require more of a certain medication. After a few years, you ask, well, what was the impact on these population groups? They said, well, we don't collect data that way. We can't know what we're doing wrong or where we might have to change things to improve people's health. I represent a territory. Although the territories did not get state-like treatment under this bill, we will finally be able to cover close to 100% of the federal poverty level in our territories under Medicaid. Finally, we'll have the opportunity to have an exchange. In our case, we may only cover up to 200% of poverty. But we're making steps, and this bill has allowed us to make steps that will allow us to begin to transform our health care system and open up access to care to our constituents that they've never had before. This is in the United States Virgin Islands, in Guam, American Samoa, the Commonwealth of the Northern Marianas, and Puerto Rico. As I said, we have a lot more to do, but we made a good start with the Affordable Care Act, and we'll continue to work until all Americans, no matter where they live in this country, have equal access to health care. And the rising costs of health care are already slowing. The best is really yet to come. In 2014, the exchanges will help to pay premiums for families that are at or below 400% of the federal poverty level. Small businesses will get even more help in the form of tax credits. There will be no denial for anyone because of pre-existing disease. The donut hole will begin to be closed. The research that this bill creates will improve the quality of health care and make us safer. And the skyrocketing health care cost increases will stop. They'll start going down. And I know that there's some in this country that feel that all of this that we talk about in this bill threatens the health care that they already have, but it doesn't. It does not. It makes the health care coverage that you already have more secure. It cannot be taken away just because you're sick. There will be no lifetime limits or annual caps, and the increases in premiums are already beginning to level off, so insurance is already becoming more affordable. The American people ought to be thanking President Obama, and I know that many do. More than 80% support the provisions of this bill, thanking the President for this landmark law, as important as the one that created Medicare. And we ought to feel good about the fact that this country is living up to the high ideals on which it was founded, and that we will no longer be shamefully lagging behind so many countries in the health of our population, not in the richest country in the world. I'm certain that if the Supreme Court decides on law and the Constitution without any political activism coming into play, as they should, this good law will prevail, and more importantly, the people in our nation will prevail. And with that, Mr. Speaker, I yield back the balance of my time.
Gentlelady yields back. Under the Speaker's announced policy of January 5th, 2011, the gentleman from Arkansas, Mr. Griffin, is recognized for 60 minutes as the designee of the Majority Leader.
Thank you, Mr. Speaker. I ask unanimous consent to revise and extend my remarks.
Without objection, so ordered.
Mr. Speaker, I've come here to the floor tonight with my colleague, Representative Duffy, to talk about the crisis facing Medicare and to talk about the Independent Payment Advisory Board. Some call it the IPAB. It's a part of the President's health care law, and this House is going to address it this week. But I want to start out by talking a little bit about the crisis that we're facing in this country over Medicare and what it means to our seniors. My mother is 71, and she's a Medicare recipient. She counts on Medicare. She paid into it and is now using it to take care of herself, and we've got to make sure that future generations are able to rely on, count on Medicare. So I want to start out this first chart here, Mr. Speaker. It shows what a significant portion of the federal budget Medicare consumes. We have it here at $555 billion, and that is per year. This is a yearly budget for the federal government. It is widely agreed upon by Democrats and Republicans that Medicare is going bankrupt. Some estimate it 7 years, 8 years, 10 years, but most everyone agrees, having looked at the numbers, that Medicare is going bankrupt. Now, I've got a quote here from Senator Lieberman, who addresses a criticism that we hear a lot about the Republican reform plan on Medicare. If we can agree that Medicare is going bankrupt, we then have to ask ourselves, what are we going to do about it? What are we doing about it? Well, the House has acted to reform Medicare. We acted last year in 2011 as part of our budget to reform Medicare to save it. The only reason we propose reforms to Medicare is because we want to save it. We want it to be there for the next generation. I've heard a lot of criticism of, you want to change Medicare as we know it. I say no. Medicare as we know it goes bankrupt on its own. We have to act to save Medicare, Mr. Speaker. And in this quote from Senator Lieberman, he says, quote, "The truth is that we cannot save Medicare as we know it. We can save Medicare only if we change it." Now, like House Republicans, I think it's fair to say, Senator Lieberman is talking about what we must do for the next generation. Like our proposal, I think a lot of us agree that we can make changes to Medicare for the next generation, and for those, for example, 55 and over, leave it as it is. Why? Because people have counted on a particular way the program works, and we don't have to change that to start saving. We can just change it for the next generation. I have another quote here I want to share with you that shows that President Obama, at least in his words, understands that we have a problem with Medicare. Quote, if you look at the numbers, Medicare in particular will run out of money, and we will not be able to sustain that program no matter how much taxes go up. This is the President. He continues, I mean, it's not an option for us to just sit by and do nothing. Unfortunately, those are just words, because that is precisely what the President has done. Sit by and do nothing. It's what the Senate has done. The House has acted to reform to save Medicare. Now, the President's health care law has a provision in it, the IPAB that I referred to earlier, that impacts Medicare, but it doesn't save Medicare. It rations Medicare. How does that work? Well, this is an unelected board. It's an unelected board that will make decisions on where Medicare is cut. So the President has had an opportunity to propose reforms to the way Medicare works so that we can innovate and change it to save it for future generations, reform it, upgrade it, do things better. But instead, the President's approach is simply to cut the levels of spending but leave the overall functioning of Medicare the same. So, no innovation, no new approach, no reform, just cut when we run out of money. Well, what does that result in? It results in seniors not getting the care they need, and not just because services are reduced, but because a lot of doctors won't take Medicare patients. This is already a problem today. Today, there are seniors looking for a doctor to help them with their particular problem, and doctor after doctor says, I'm sorry, we don't take Medicare. That problem is only going to get worse if the IPAB, the Independent Payment Advisory Board, that's in the President's health care law, if it does what it is scheduled to do. Now, what are we doing about it here in the House? Well, we certainly voted to repeal the President's health care law. That passed the House, did not pass the Senate, but we've tried a lot of other ways to get at the problem, and one that we're going to do this week is to repeal the IPAB, repeal the Independent Payment Advisory Board. And I've invited my friend, the gentleman from Wisconsin, here tonight, who wanted to join me on the floor to talk about this. And I yield to the gentleman from Wisconsin.
I appreciate the gentleman from Arkansas yielding. I want to take a couple steps back in this conversation and first talk about the national debt. Many Americans are well aware that today we owe well over $15 trillion in national debt. This year alone, we're going to borrow $1.3 trillion on top of $1 trillion last year and the year before that. There are trillion-dollar deficits as far as the eye can see. And last year, the House Republicans put forward a budget that showed a path to balance, telling the American people how we balance the American budget at some point in the future. Now, last year and this year, the President put out a budget, neither of which ever balanced, never telling the American people what his plan is to bring American spending to balance with its revenues. And so we look a couple years back when the President in this House passed the Affordable Care Act, or Obamacare, which the CBO now states that over 10 years, the rosiest of projections say it's going to cost the country nearly $2 trillion more. even when they put out that budget or that proposal for health care reform, they're still not willing to put out a budget that says how we're going to pay for it. That concerns me. I'm a father of 6. We're spending today and passing the bill off to the next generation. It's unconscionable. Let's actually talk about what the President and this House has passed in Obamacare. $2 trillion over 10 years in additional spending. It's a bill that is going to power bureaucrats in this town to make health care decisions for Americans in every part of the country instead of your family, your health care provider, or you making that decision. And listen, I'm from Wisconsin, and I know that the values that we have in central Wisconsin, they're probably a little bit different than Arkansas or Kansas or Kentucky, Minnesota or Michigan. And I think we should allow people to make their health care decisions instead of bureaucrats in Washington. But what concerns me the most is how Obamacare impacts Medicare. Now listen, Obamacare takes $500 billion out of Medicare and uses it to fund Obamacare. And now we all know in America that we have some financial pressures on Medicare. And we know that we have to come together as a country, as a community, both parties, to figure out how we're going to pay for Medicare, keep the promise to our seniors. And at a time when we're still having that debate, to think that this House would pass a bill and take $500 billion out of Medicare and use it for Obamacare, I think that's wrong. Let's first figure out how we keep the promise to our seniors before you make a promise to anyone else with their money. That's unconscionable. What concerns me the most is what the gentleman from Arkansas mentioned, which is the Independent Payment Advisory Board. It's the IPAB board, and we haven't heard a lot about it, but I think you'll hear a lot more as the months go on. This is a board of 15 unelected bureaucrats. And what they're going to do is look at reimbursement rates with Medicare, and they are going to be able to systematically reduce reimbursements to doctors, hospitals, and clinics for the care for our seniors. And let's make no mistake, this is reimbursements for our current seniors, not for some future generation. It's for today's seniors. And the argument by the President goes like this: Mr. and Mrs. Senior, don't you worry about your quality of care or your access to care. We're just going to pay your doctor, your hospital, and your clinic less for your care. If you believe that, I've got oceanfront land for you in Arizona. Of course it's going to affect our seniors' access and quality of care. When you pay less for it, you're going to get less of it. And our seniors, they've worked a lifetime. They've bargained. They've retired based on this promise for Medicare. And this proposal doesn't meet that obligation. It takes $500 billion from Medicare, but then is going to ration the care of our current seniors. Seniors who can't go back into the workforce and get another job, they've retired based on their promise from the federal government, and Obamacare reduces that bargain that's been made with our seniors.
Will the gentleman yield for a quick point?
Sure.
You know what really scares me is that this restricted access to health care, to Medicare that you're talking about, it already exists. The IPAB, the Independent Payment Advisory Board, that's in Obamacare, that will cut the amount of reimbursement to doctors when it gets going. It's not even cutting yet, and we already have a problem with seniors getting the doctor that they want, because so many doctors have said, I'm just not going to take Medicare anymore. And I just wanted, before I yield back, I just wanted to mention an email that I got in my office this week. There was a constituent of mine, John Pollitt. He's the program administrator for the Arkansas Senior Medicare Patrol. He goes around and he talks with seniors about Medicare and how to recognize fraud in Medicare. And he was at the Sherwood Senior Center this week, in my district, and he was giving a presentation teaching Arkansas seniors about Medicare fraud. And a lady, a senior who's on Medicare, an angry senior, said to him, she wasn't angry at him, but she said with passion, quote, "I don't understand why I'm forced to pay my Medicare premium but can't find a doctor who will take me because I'm on Medicare," end quote. So we already have a problem with access to Medicare because doctors, more and more doctors, are saying, I'm not going to take Medicare. And there are a host of reasons, the reimbursement rate, the administrative hassle, what have you. But IPAB, I hear the gentleman from Wisconsin saying, the Independent Payment Advisory Board that's in Obamacare is only going to make the problem worse. Because while some of us are interested in reforming the way Medicare works so that we get more service for our dollar, the President is only interested in saving money by just reducing and cutting without reforming. We all understand the need to reach solvency. But those of us who back Medicare reform want to do it through innovative, creative, cost-saving approaches that avoid rationing, whereas the President simply wants to cut through an unelected board. I want to yield back now to the gentleman from Wisconsin. I just thought it would be helpful to give you a real-life example of a senior in my district who's been impacted by that.
And I appreciate the gentleman for telling that compelling story. All of us have stories like that from people in our districts, from our own family members, our friends, our constituents. And this is a very important issue. And that's why I think we have to have this conversation about what the Independent Payment Advisory Board will do. And we're used to, I was a former prosecutor, and we're used to a system where if you don't like the decision of a court, oftentimes you're able to appeal that decision. This board is unappealable. The decisions that they make, the 15 members, when they make a decision, that is going to be the law, that is going to be the rule, and you can't appeal it and you can't have it overturned. And so I just want to close my comments up on the Independent Payment Advisory Board. We don't believe on the Republican House side that we should go forward with a plan that was going to systematically reduce reimbursements for seniors, that's going to affect the quality and access to care for our seniors. Let's give them what they bargained for. We in the House Republican side, we said, put back the $500 billion. Put that back into Medicare. Do away with the IPAB board. If you're going to make changes to Medicare, make it for a future generation, a generation that isn't near their retirement, a generation that will have enough time to plan for the changes in Medicare. But don't pull the rug out from our seniors who've been given a promise and now aren't going to get it because their Medicare is going to be rationed. We think it's fair to do it for a future generation. But let's make no mistake. When we hear that one party has transformed Medicare or changed Medicare as we know it, there is one party who has done that, and that's the Democrat Party in Obamacare. They have changed the way that Medicare is going to work. They are going to ration it. We believe we should save it, protect it, preserve it, and I know my freshman colleagues in this House are going to fight tooth and nail to make sure that every one of our seniors get exactly what they bargained for in Medicare, and if there are changes, it's going to be for a generation that can plan for the change in Medicare in due time and due course. With that, I yield back to the gentleman from Arkansas.
I thank the gentleman for joining us here on the floor tonight. I see my friend, Mr. Quayle from Arizona, here with us on the floor, and I'd like to yield Mr. Quayle at this time.
Well, I thank the gentleman for yielding and listening to his comments about talking with his constituents back home and about how many doctors are not seeing Medicare patients, not seeing new Medicare patients, or are not seeing the patients that they currently provide services to. And I know, like the gentleman from Arkansas, he does a lot of teletown halls and town halls just like I do. And the other week, I was on a teletown hall with my constituents back home, and there were a number of people who raised the concerns that their doctors were not going to provide them the medical services that they had in the past because they were uncertain about the payments that the Medicare system would be giving them. This is a constant refrain that we hear back home from our seniors, that they are consistently getting turned down by their physicians because of the lack of payment from Medicare. This is a system that we need to fix. This is a system that we need to make sure that we keep the promises to our seniors and reform it for future generations so that it will be there to protect them when they reach the retirement age. But if you look at Obamacare, it is really filled with provisions that confer arbitrary power, it raises costs, it cuts benefits, it harms access, and it restricts choice. Against this really sorry backdrop, the Independent Payment Advisory Board, or IPAB, has the dubious distinction of being one of the absolute worst provisions in the entire health care bill. Indeed, this single provision causes all the problems I just mentioned. This board of 15 unelected, unaccountable bureaucrats would have the power to impose price controls that will cut senior access to care. To make it worse, this board would not have to meet in public or listen to public input. Amazingly, Obamacare even leaves the door wide open for IPAB members to receive gifts from lobbyists. In other words, the public has no right to talk to IPAB, but lobbyists willing to shower them with gifts do. President Obama claims his rationing board would solve the real problem of Medicare's rising costs. It doesn't. The only mandate the board has to cut costs is by restricting payments to doctors that provide health care. It is already the case that 12% of doctors will not take Medicare patients due to the unreliability of government payouts. That is twice the number of doctors who refused to see Medicare patients in 2004, which is a frightening statistic on how quickly that is rising. Additionally, a recent survey showed that 60% of doctors will have or will restrict their medical practices as a result of Obamacare, and those doctors, 87% said they would be forced to restrict the amount of care they offered to Medicare patients. Obamacare utterly ignores the laws of economics in this instance. You can't cut the cost of a service by cutting the number of people supplying it. But that's exactly what IPAB would do. By forcing doctors to turn away Medicare patients, the cost will go up as fewer and fewer doctors see to the needs of the growing number of seniors. Either that or IPAB will directly ration care. It is astounding that the President would look at an important issue like caring for our seniors and decide that the best way to handle rising costs is by attacking senior access to health care and the doctors who provide it. Medicare does need reform, as my friend from Arkansas knows and has been on the floor numerous times talking about the reforms that are necessary. But it needs real structural reform that protects access for our current seniors and fixes the system for future generations. As with so many other issues, the President punted on making these needed reforms. Instead, he chose to give us a rationing board that would make the problem worse. Let's repeal IPAB and give our seniors the care that they deserve. I yield back to my friend from Arkansas.
I thank the gentleman from Arizona. I wanted to just point out that 70 House Democrats, 70 House Democrats opposed IPAB when it was being debated in the President's health care law. Before I ever got to Congress, 70. And in fact, it wasn't in the House version. And I am hopeful that some of the Democrats who have come out against IPAB will join us in repealing it so we can move on to truly reforming Medicare to save it. I see my friend, the gentleman from Tennessee. We are lucky, fortunate to have some physicians, many physicians, serving with us here in the House of Representatives, and they bring an expertise in this area that really helps us when we're working on solutions to the problems with Medicare and Medicaid. And I see one of them has joined us here on the floor tonight. I'd like to yield to my friend from Tennessee.
I thank the gentleman, and I think that it's great that we're taking time tonight to discuss such an important issue that is so near and dear to all of our seniors, because this last year, quite frankly, has been a very confusing time as we try to reform and fix the problems that face Medicare today. We have, without a doubt, a number of seniors that are having trouble finding access to care right now for all the reasons my colleagues have stated, that we have a flawed payment formula in the SGR, or Sustained Growth Rate formula, and we've made attempts to correct that this year, but again, as they so often have done now for the past 13, 14 years, they've just pushed the problem down the road rather than deal with it. So, I don't think it hurts to review for a minute what problems are facing Medicare. We can't deny for a second, Mr. Speaker, that Medicare is going broke. You can talk to any number of agencies, whether it's CBO, AARP. We all know that Medicare is on an unsustainable course. Medicare is quite simply going to be broke in about 10 years. That's not a Republican problem. That's not a Democrat problem. That's a people problem. And what we're here about tonight is to make sure our seniors don't have to worry where their health care is going to come from. So we must get together and take steps to make sure that their access to care is preserved and protected. We did this earlier last year with the Paul Ryan budget. We put forth a sensible reform that would put Medicare on a path to sustainability. If you're 55 or older, you don't have to worry about any changes to your current health care. That was grossly distorted in the press and in the media. We were accused of literally, there were TV ads made of pushing an elderly person off a cliff. And this is just plain and simple wrong to create that kind of uncertainty for our seniors. Now, the bottom line is we have 10,000 new Medicare recipients entering the Medicare pool every day. We have a situation where when Medicare was first formed in 1965, that the average life expectancy of a male was 68. Well, thanks to advances in medicine, men and women both are living at least 10 years longer. However, this was not managed in the budgeting for Medicare, and hence we've gone deeper and deeper into debt. And now our average couple that pays about $109,000 into the Medicare system over a lifetime extracts about $340,000, so about $1 in for $3 out. So again, there's no denying that we have a problem. This is going broke. Well, the Republicans did offer a solution, as I said, and my colleagues have said. However, right now, the IPAB is the only solution we've seen in President Obama's plan to cut costs, but it is going to gut $500 billion from our seniors, and that's the fact that they need to know about. They need to call the representatives.
Well, gentleman yield.
Yes, sir.
I just want to make sure I understand or I'm able to communicate what the gentleman is saying. What you're saying, correct me if I am wrong, but what you're saying is the House has a plan to reform Medicare to save it. As far as I know, I haven't seen any other plan to save Medicare pass the Senate. Haven't seen the President propose a plan to save Medicare. There's only one. Now, the President has a plan for Medicare, but it's not to save it. And it really doesn't reduce costs through innovation or what have you. It just cuts. And the cuts are decided upon by unelected bureaucrats who are on this IPAB, the Independent Payment Advisory Board. Now, you mentioned the television ads. I had television ads run back in my district. They talked about how I and others wanted to change Medicare as we know it. Well, I quoted Senator Lieberman earlier, who said, can't save Medicare as we know it because it's going bankrupt. So what I say to folks is, we have to reform it. And I'm happy to have a discussion and debate and compare this reform with that reform. Happy to do that. What is intellectually dishonest, though, is to compare reforms that I advocate or you advocate, to compare those to the way it is now. That's intellectually dishonest. It's actually deception. Why is that deception? Because the way things are now, it's not going to be that way. 7, 8, 9, 10 years. It's unsustainable, the path we're on with regard to Medicare. So if someone says your reform changes Medicare as we know it, that in and of itself, if it is presented to demagogue, that in and of itself is intellectually dishonest, because Medicare as we know it goes bankrupt and changes itself. So I am happy to have a conversation to compare this reform with that reform. I don't claim to have a monopoly, certainly do not have a monopoly on wisdom in this area. I think we ought to be having a free and open debate of reform ideas that save Medicare for seniors. But what we can't do is mislead people, mislead seniors into believing that Medicare as it currently functions is sustainable. That's not true. That's not true. And folks who continue to talk about Medicare as we know it need to point out that Medicare as we know it ends on its own, by itself. The Congress of the United States could do nothing on this for 10, 20, 30 years, whatever, and Medicare would go bankrupt with no congressional action. So our job, as I see it, is to take affirmative steps to save Medicare, to maintain the quality, so that doctors still want to take Medicare patients, and reform it to save it for people, seniors like my mother. But we've got to start with the fundamental idea that we can debate reforms, but comparing reform to an unsustainable status quo is intellectually dishonest. I yield back to the gentleman.
Well, my friend's absolutely correct. What we need to do here, if nothing else, is we need to agree on the facts. And the facts, as you just stated, are that Medicare is going broke. It is on an unsustainable course. So Medicare must be changed as we know it, as you said. And you mentioned your mother. My mother happens to be having her 73rd birthday today. It's a happy birthday for my mother today, but I hope that she has many more happy birthdays to come. And we all have those stories. We all have parents, grandparents. We know people on Medicare that are counting on this. They're looking at these arguments going on in this chamber, and they're confused. They don't know what to believe. So I think if we can agree, as you said, to the facts and then sit down and have a meaningful discussion of how we can preserve and protect this program for future generations, then that's half the battle.
Even a bipartisan discussion, I welcome it. In fact, I was proud to see that a Democrat from the Senate joined with a Republican in the House on a Medicare reform plan. And I'm happy to debate all these different plans as long as they have the ability to save Medicare and guarantee quality care for seniors. If we end up debating reforms on the one hand versus the status quo, the way things are now, Medicare as we know it on the other hand, we can't have that debate. Because the whole point is that Medicare as we know it, the status quo, Medicare as it is now, it's going bankrupt. So any discussion of the options has to be between the different options that save Medicare. The problem is there's only one plan that saves Medicare that has passed the House or the Senate or that's been proposed by the President, and that is the House budget plan from last year, and we will, I am confident, have a plan this year that we will vote on shortly that will propose changes to save Medicare. I want to thank the gentleman for joining us here tonight. Do you have anything else you want to add?
No, I mean, I agree with what you're saying, and I'll guarantee you, any of the seniors watching tonight, listening to this debate, they don't care whether the Republicans win this debate or whether the Democrats win this debate. That's irrelevant. What they want to know is that they're going to have access to care, and I think it's so essential that we repeal this IPAB. The gentleman was with me earlier today at a press conference when they asked about all the rhetoric last year about these being called death panels. And you know, that may sound a little bit theatrical, but I can tell you as a physician that if I'm treating a patient who's 78 or 88 and they've got some form of cancer, and this IPAB board decides in the government one-size-fits-all mentality to throw a blanket over seniors of a certain age who have a certain disease, and cancer is probably a good one to pick, that they don't necessarily need to spend that expensive money on chemotherapy or experimental drugs, or perhaps they don't even want me to order the MRI to detect the cancer. Now, if you're 78 or 88, that may sound so old to some people, but I know a lot of people that age that are very active. They've got 15 or 20 grandchildren, and those grandchildren enjoy their company. And so if they make a decision that these people shouldn't get that treatment, that's very well what could happen with this board, then you decide what kind of panel or what kind of name you want to put on it.
I think ultimately the IPAB seeks to save money by simply cutting blindly without regard to innovation, without regard to structural reform, simply having a board of unelected bureaucrats ration care by making decisions on what Medicare will cover, won't cover, and by how much. Yes, we need to do what is fiscally right, but we need to keep our promise to our seniors. And the way that you do both, is to reform Medicare structurally, not blindly cut, leaving all the rules the same, just reducing what you're paying doctors. That's not the path. That's not the path. That is, in effect, rationing, and that will continue to exacerbate the problem of Medicare recipients being unable to find doctors who will take them. The answer is to take Medicare that has been so good to so many seniors and reform it and innovate and make changes that won't just cut costs by reducing the money paid, but will actually change the rules so that we are able to get more value and more services for our dollar. And that's the approach we have to take.
I'll just add one more point. I can tell you that there's not a senior I've talked to that wants a bureaucrat in the exam room with us making their decisions. We build relationships with those patients. There's a trust between the patient and their doctor, and I'll guarantee you the patients don't want bureaucrats overseeing that exam room making those decisions for them. So when we move forward with these reforms, we certainly need to keep that in mind. And I'd like to thank the gentleman for leading this hour on such an important topic.
I thank the gentleman from Tennessee for his service here in the Congress and as a physician. I thank you for Thank him for joining me here tonight. And I just want to reiterate what you said. Whatever solution we come up with has got to be patient-centered and respect the doctor-patient relationship. Patient-centered, not government bureaucracy-centered, patient-centered. I thank the gentleman for joining me. I thank all of my colleagues for joining us here tonight. I yield back the balance of my time.
Gentleman yields back. The chair lays before the House an enrolled bill.
H.R. 473, an act to provide for the conveyance of approximately 140 acres of land in the Ouachita National Forest in Oklahoma to the Indian Nations Council Incorporated of the Boy Scouts of America and for other purposes.
For what purpose does the gentleman from Arkansas rise?
That the House adjourn.
The question is on the motion to adjourn. Those in favor say aye. Those opposed, no. The ayes have it. The motion is adopted. Accordingly, the House stands adjourned until 10 a.m. tomorrow for morning hour debate.
Today in the House, members debated bills related to